normal, but they have some learning disabilities or dyslexia, you can treat them and they easily can be shifted to normal school. But children who are mentally retarded, whose cognitive level is poor, whose perceptual level is poor, we have difficulties like they are not able to use their hand functions properly. They are not able to manipulate, they are not able to coordinate, they are not able to understand shapes, sizes and colors.
Basically, senses, it has multi-disability type of patients. We have autism, Down syndrome, cerebral palsy, mental retardation, schizophrenia. So with that, you have to have a different approach when it comes to doing the therapy.
Misunderstanding when they take what you're saying as something else or they don't understand it. So what I like to do is relate the new concept with something they already know. And the other one is if they sometimes forget things very quickly. So what I like to do is reinforce. Like there's this one little girl and I was teaching her body parts. Every day I'll tell her eyes, nose, and I'll point to the body part, and that way she's remembering them a lot quicker. And you can do this with anything like colors, numbers, body parts, anything.
Our main focus is more on the cerebral palsy patients, and each type of cerebral palsy patients have different characteristics. Sometimes you have to think of a new treatment program for each children. So I think that is the difficult part in doing a therapy program with the patient. Our main strategy for this kind of patient is to be able to be independent in all aspects of ADLs.
These all three things are very important. This kind of conventional therapy helps him to integrate, learn his activities of daily living. Then outdoor help him to social interaction. He's able to understand how to interact socially, how to behave socially. Computer learnings have enabled them to learn more quicker and more faster. Things which children learns on computer, when we try to integrate in daily living skills, they are not able to do so. Conventional is also as important as computer and outdoor. If same activity is repeated at home, for example like dressing, like buttoning or toileting, so if both all teachers, therapists, caretakers and parents together work and not depend only on center that okay 1 hour working will be enough. No, same work you have to give them at home. You have to educate the parent how to complete the task.
Yes, we have our home instructions. So usually we gather the parents and we teach them the proper way of exercising the patients while patient is at home. And we teach everything to the parents.
As a volunteer, it is normal to feel a sense of achievement when a child learns something new because of what you're doing, and that way you know what you're doing is right.
It's one of the fulfilling jobs, whenever we see a child improving, it brings happiness to us.
There's this little girl called Mamuna. She's really fun and very spirited, and today we were actually teaching her letters, and I think this is going to help her form words and potentially sentences, and she's starting to use phrases and words. Teaching her letters is also teaching her new words. For example, A for apple, B for ball, and she's going on to F and G, and we're trying to expand that learning.
Zain Haider, he started with us like he was just lying down and without any movement of his body. And upon giving a regular therapy to him, Zain, he can sit independently, he can crawl, he can from supine to sitting, he can stand with assist, and he can walk with assist also. So these are really an amazing achievement.
We have two children. One is finishing our 2 years training here. He went to normal school.
Before we were having one guy here, his name was Khalid. So he was having difficulty in speaking, his speech was not so clear. and he was not used to the environment of like going to school and sitting and all those things, and his ability to cope the things were very slow. When he interacted here, we worked with him with 1 year, and suddenly there was so much in that. He used to love the school, he used to love the working, peer group relationship he started developing. And if you work with them year or 1 year and you use different techniques of learning, they can be easily integrated to a normal school.
A lot of progressions I've seen with our patients, mostly with the patients with cerebral palsy. You know, these patients are really hard to work with, especially, you know, they have so many complications, but still we were still able to achieve our physiotherapy goals, which is basically to help them, make them independent and the highest functional level that they can have. So we teach them first on how to crawl by themselves and sitting and standing. So there are a lot of progressions.
About the children and the people with disabilities, it's also about the volunteers, because we're learning to be patient, we're learning to teach those with disabilities, and we're learning different methods here. And also for them, it's really nice to see them learn new things and kind of communicate and be open-minded.
Basically, I am here, you know, with a purpose, and I think that God sent me to this kind of institution to help children. You know, and really, I left my family in the Philippines to work with this kind of patients. It's a big responsibility in our part, you know, to help these kids. And I think the main function of physiotherapy that we want to achieve with our children is that we want them to be independent in all aspects of daily living. Like, we also give our full heart to them, you know, and help them realize that there are still people who care and love these children.
They can also set goals for themselves, or their volunteers can kind of have little goals for them. So there's a little girl, Marina, and today the goal was to teach her a few words and letters, and also the achievement is really an important part of what we're doing here, because that'll help her lead a better life.
Our evaluation is over with the child. We understand where is the problem lying, whether it is a perceptual, whether it is sensory, whether it is a motor. So accordingly, if we come to know, no, the problem is that baby is not able to understand shapes, sizes and colors, big and small. So accordingly, we plan our treatment or therapy programs or goals, and we make a short-term goal. Okay, in this 1 month, we are going to teach him the shapes. And when we teach, we pick individual shapes like a circle or triangle or size particular. And once we finish with this 1 month program, we integrate that with shapes and size, and we try to check whether the child is able to learn or not.
So recently, Senses had this opportunity to build a hydrotherapy pool with the kids, and this is one of the best strategy that we can give to our patient. You know, it's a hydrotherapy pool. Aside from that pool exercise we're giving, there's also a warm water, which will help the patients to relax the muscles, and it's also it will benefit also with the children with autism. And this kind of strategies, you know, we want to improve our knowledge also on proper handling patients with different cases of disability. So now, I mean, in the market there are a lot of new items that we could use for the patients.
Some child has CP and he is not able to do his buttoning, so you have to do adaptation to do the buttoning. For eating also, if he is not able to eat with a normal spoon, you have to give different shapes to the spoon. If he is spilling the food, you have to give the plate guard. If there is a risk of fall in the bathroom. So with physical disabilities, you have to give adaptation to overcome his disability, and he should lead a normal life. But in autism cases, they have sensory integration problem, they cry, they shout. So different type of frame of references you have to use, neurodevelopmental, proprioceptive, nuclear facilitation, these kinds of different techniques you have to use with these kids. And more people should come to know about special needs, so it becomes easy to integrate them in society. And not all the work in the world requires great deal of ability. Some work are so simple and it matches their abilities. So if you integrate with them and if you know that special needs children is a part of society, yes, you will allow them to put them to certain jobs. And yes, and in this way we can sort out our problems.
As a physiotherapy, I really enjoyed working with children and just seeing them smile and seeing them with some progression. This will overcome all the difficulties that we are experiencing with these kids.